I will start by comparing psychotherapy, marijuana and SSRI with one very specific example when we are talking about an anxiety. For instance, if we are talking about younger adolescent populations with post-traumatic stress disorder, it has been shown that, for instance, crucial factor is family therapy, because the child will be back into dysfunctional home after some kind of traumatic events. So we have example that individual therapy and SSRI antidepressant are not as efficient as individual therapy and family therapy. But comparing to marijuana and SSRI, this is my general opinion. Smoking marijuana or antidepressants for an anxiety. First of all, I would like to say that anxiety, we can approach it through one scale that has three dimensions. First, this feeling of unsafety, that you want to hide in some safe place. Second are somatic symptoms in your body, heat or heartbeats and so on. And third one is worry. If we go deeper into concept of an anxiety, we will see that it is connected to positive effect and a negative effect, positive emotions and negative emotions, but mostly with negative emotions. So we can decrease an anxiety by increasing positive emotions, or we can decrease an anxiety by reducing negative effect. In different experiments and research, it has been shown that most antidepressants, for instance SSRI, are increasing positive effect by 2 times compared to placebo, and up to 6 or 7 times reducing in a negative effect. So they are reducing neuroticism and negative affectivity, and this in a way is causing that people are feeling better, because they react. There is this garden of life, more react recognition of positive, beautiful flowers than those that are dangerous. And also you see world in a better view. Marijuana in short term can reduce anxiety, but more in terms of, for instance, like coffee, you have some ritual, but in most studies, when compared with control group, people long term became more noxious and more depressed, more aggressive. If we talk about young people, it definitely alters the normal brain development and personality development. So I would say it is very specific positive effect of marijuana and cannabis for treatment of pain, but for most other people will do more harm, and this is not a way to handle your life problems. And SSRI, on the other hand, are reducing stress, inflammation processes and so on that are related to many different diseases, even, for instance, protect people who had multiple sclerosis from relapse of their illness. So I would go with SSRI or antidepressants, and I would avoid smoking marijuana. Few comments on umbrella review that is in a way a critique of serotonin theory of depression and brain imbalance theory. In my opinion, it is just one more Caspi et al. And Daryl Bem and similar stories with great fuss but little value. I would say this: antidepressants do work.